Hello everybody, welcome back to my channel. I'm Dr. Pardos, the speech language pathologist and owner of Augmentability Speech Therapy. Welcome to this channel where we talk about lots of things, AAC, disability advocacy, and kind of anything else that comes up. We had busted 5 AAC myths before, and we are here to bust some more. So buckle in as we break down 4 more AAC myths. AAC myth 1. Well, 6? Let's go with 1. AAC myth 1 for today is it can be too soon after a neurological event like a stroke or a traumatic brain injury for somebody to be introduced to AAC. This is false. Like I had mentioned in one of the myths from the previous myth video that's apparently living over there, AAC is augmentative. It can add or it can substitute communication. Augmentative, alternative. So after somebody has a neurological event, it is never too soon because they may not be able to speak for a variety of reasons. It could have been where the neurological event happened in their brain. It can also be, do they have tubes in their mouth? Like, what's happening? Like, is there something down their throat? Is there a trach? Like, there's so many things in that setting, in an acute setting, like in a hospital, after somebody has a neurological event like that, that can impact communication. So having any way to communicate can be so helpful and so impactful. For example, sometimes people aren't able to think of the word, but they know what they want to say after a neurological event. So if you show them pictures or have some form of AAC, they will be able to look at that, and if they see the picture of what they're thinking about, they're going to be able to communicate that to you, which is so important. Especially if you can think of like the discomforts and everything that may happen after a neurological event, or if anybody's just ever been in the hospital for any reason at all, like they try, but like it's not a very comfy place. So being able to communicate anything, but particularly those wants and needs, to try to like get those healthcare needs met and communicate really important information like that is so vital. So no, not too early after a neurological event. Myth number 2. People can be too young to introduce AAC. A lot of times parents will be like, no, I don't want AAC yet. Maybe they'll start talking. But as we learned in the first video, AAC will never hurt. It's never going to hurt somebody's communication. So introducing any form of AAC at an early age, even be it in early intervention, is only going to help that kid learn to communicate. And like another myth we busted, there's no cognitive prerequisite to AAC. So I feel like maybe they need to mature a little bit. No, they don't. They can be really little and bopping around and still benefit from AAC. It will only help. This next one is good. Myth number 3, you have to start with low-tech AAC before you can get a high-tech AAC. Now, if you don't know what low-tech and high-tech AAC is, don't worry your pretty little self. There will be a video coming out about all things AAC. So, well, all things AAC definitions. But the SparkNotes version is low-tech AAC, think writing pen and paper. To a high-tech AAC is like something like an iPad that generates speech for you. So a lot of times people think, we need to start with communicating with pictures. We need to start with a single message button before we can get the speech generating device. That's not true. You can go straight to the speech generating device if that works best for you. There are some people, some communicators who, you know what, low tech is better. Mid tech might be better for them. High tech is not better than low tech or mid tech or no tech. And you don't have to start with low tech. AAC is not linear. There's no specific trajectory that you need to go on to find a communication device or any kind of AAC that works best for that communicator. All right, myth number 4, and the last myth of this session is that only the AAC device is required. None of the additional assistive technology and accessibility tools are needed, just the device. This is so false. It is all medically necessary. I'm sure we have all heard about this wonderful world of insurance saying that things need to be medically necessary. If somebody has cerebral palsy and they can't use direct selection with their hands, how are they going to be able to use a device? They can't use it with their hands. They might need an eye gaze, or there could be somebody who is, blind or has some vision loss and also needs an AAC. The AAC in itself isn't going to do anything if there's no way for that person to access the device. So having all of this extra equipment and accessibility tools are so important to help access the AAC device. All of these wonderful things Okay, those were 4 more AAC myths busted, and my cat decided she needed to be in the end of the video. So thank you for watching this video. If you have any more questions about AAC or have any other myths about AAC, put those in the comments below and I will try to answer them, or maybe I'll make another AAC myth video or a video just answering your questions about augmentative and alternative communication. Once again, I am Dr. Pardos, speech-language pathologist and owner of Augmentability Speech Therapy, here to teach you about AAC, advocacy, and a little bit of everything else. And thank you for watching this video. I hope you learned something today, and keep on learning. I'll see you in another video soon. What that flyaway was. Okay, bye.